Hello everybody, I'm Paul Tambyah. I'm an infectious disease physician and professor of medicine. I'm giving this talk here in my personal capacity as chairman of the Singapore Democratic Party and not in connection with any university or hospital. This is a special edition of Ask Paul Anything, and here is part 2. Okay, the first question is from Dimitri Minelli. The question is the virus airborne or will it become airborne? Now, I really don't think that the virus is airborne, and the reason is that if the virus was airborne, there would be far more people infected. I'll give you an example. So the family who came here from Wuhan, and then they went on a bus and they went to Malaysia. So 2 of them were infected in Singapore, and then 4 of them were subsequently found to be infected in Malaysia. Now, if this virus was truly an airborne virus, you'd expect the whole bus to be infected. And that's what happens with airborne viruses, like, for example, chickenpox and measles. Before the vaccine appeared, when I was just talking to somebody from the military, that once one person in the camp gets chickenpox, the whole bunk is going to come down with chickenpox pretty soon. So fortunately, we have vaccines for chickenpox and measles, but otherwise, airborne viruses really spread very fast, and that's not what we have seen with this virus. Question is, can it become airborne? And the answer is maybe. And we know this from SARS, that even though most of the time SARS was spread by droplet transmission, in certain situations, like when they're doing certain medical procedures, like giving nebulizers or doing intubations, it's possible for the virus to become airborne, but that's only for a short period of time and for a short distance. Next question is from Sivamuthi Don Nagapan, and the question is, how is this virus treated if the individual is infected? Now, for most viral infections, we depend on our own immune system to fight the virus. There's a lot of intense research going on about how to treat the virus. And what is interesting is that some of the early drugs which seem to be promising are drugs that are used to treat HIV. For example, there's a drug which has been used for more than 10 years to treat HIV called lopinavir/ritonavir. And that has been used in many patients, including some of the patients here in Singapore, to treat them for this viral infection. There are other drugs which are under study, and Singapore, together with other countries, is going to be taking part in a clinical trial to see whether these drugs are truly safe and effective in patients with COVID-19 infection. Now we have 3 questions from Yon Tan. The first question was also asked by Jennifer Lim Sumien. The question was, is it true that sunlight and UV rays from the sun can damage the virus, making it unable to function properly? And the answer is yes. We do know that sunlight and UV rays are toxic to viruses, but they're also toxic to human cells. So I don't encourage you to go and sun yourself or put yourself under UV light. That's the way to get skin cancer, because they damage DNA and they can affect viruses, bacteria, as well as humans. So we do use them for terminal disinfection of rooms where patients with the COVID virus had been. Some hospitals are using UV light to sterilize, or not so much sterilize, but rather to disinfect the rooms, but it's not recommended on a routine basis. Next question from Yon. I've read news articles that say in China currently they're using the blood from recovered patients and injecting it into the infected patients with extremely good results. What do you think of this? Is Singapore using this sort of treatment too? Well, the answer is, so far in Singapore, as far as I know, we haven't used this treatment, but this is a very old treatment. It was used almost 100 years ago, before we had antibiotics or antivirals. What they did was they would bleed patients who had recovered from the illness and use the immunity that these patients had generated to treat new patients. So this is something that people have looked at with MERS, and in Hong Kong, they even explored this for SARS as well. I have a friend, he's a doctor, he recovered from SARS, and as soon as this virus appeared in Singapore, he called me up, he said, hey, I'm willing to donate some of my plasma because maybe my plasma can help cure somebody. And that's a really amazing thing that people are willing to do, but so far we haven't had the need to do it, so the jury is still out on that one. Next question, if I walk past an infected person and let's say I hold my breath while walking past him, will I still get the virus? And frankly, the chances of getting the virus just walking past somebody are really slim. We have no evidence that anybody has actually picked up the virus that way, so don't hold your breath. I don't think that's worth it. Next question from Jeremy Tan. Is there any COVID-19 all you need to know website? And again, there are many websites. Some of them are giving inaccurate information, but websites such as the World Health Organization, the US CDC, and the Singapore Ministry of Health have very important and useful information. The universities also are putting out websites, and it's important to just look at these websites and judge for yourself based on the information that they put out. Okay, the next question was asked by two people, by someone called Gibbon and also by Sun Wu. And the question was, so do we really need to wear a mask? And the answer is, I think if you are going to be in a position where you're at risk, like for example, if you're working at a triage station in a hospital, or if you're a nurse or a doctor looking after patients who are coughing, then you probably should wear a mask. In fact, that's recommended for patients who are suspected or confirmed to have the COVID-19 infection. In general, the public doesn't really need to wear a mask. I know there's some people who say when they take the MRT, there are people coughing in front of them. Then maybe you want to think about it. But ideally, you shouldn't be coughing on the MRT. The next question is from Kathleen Tan. And the question was, since masks are out of stock in Singapore, can we buy cloth masks to protect ourselves? And again, the reality is that we probably don't need a mask if you're healthy or you're not in an at-risk situation. But cloth masks actually do serve one function. What they do is they prevent you from touching your nose and your mouth. If you're wearing a cloth mask, then there's a barrier there. And there's evidence that a lot of this infection is actually spread from contact. So if you are the kind of person, who likes to hold on to handrails or cling on to the strap in the MRT and you're worried that somebody has sneezed onto it or something like that, then, I think there's no harm in wearing a cloth mask if you don't mind it. Personally, I don't like wearing masks. I find it very hard to breathe through masks. I took someone to a clinic just recently, and I couldn't understand what the nurse was saying because she was talking to me through a mask. So, masks actually, they form a barrier between people. So I would only use a mask when I really needed to, like if I'm attending to a patient who's sick, who's got pneumonia, who's got a flu, or some other illness. Next question, and this is the last one here, from Song Wu. Will Wuhan virus last another 6 months? And that, of course, is the $64 million question. Nobody knows when the virus is going to die out or when it's going to go away. But I can tell you, I've gone on record as saying that I believe that when the warm weather hits the northern hemisphere, it hits Italy, it hits Korea, it hits China, then I think the virus is going to disappear. And there are a couple of reasons for this. The first reason is those of us who remember SARS will remember that in 2003, the incidence of the virus was going up and up and up. And then in late May, it just suddenly disappeared when the warm weather reached China. The second reason is that this is a respiratory virus infection. It's a bit like the flu. And the flu in temperate countries has a very well demarcated season. It occurs in the winter. When the spring comes, the flu disappears. I do clinical research on patients with the flu. And every time a company will come to me, they'll say, you have to get the study started by September or October, otherwise we'll miss the season. And I tell them, look, in Singapore we have flu all through the year, but we have low levels. We don't have the explosive outbreaks that you have in temperate countries. So I think for these two reasons, I'm optimistic that we'll have a quiet June. The virus will disappear by the end of May. I hope I'm right. Thank you for your questions and for being active participants in Ask Paul Anything. Just remember, practice good hand hygiene. If you're unwell, go and see a doctor. Preferably go to one of the pandemic preparedness clinics. You'll get 5 days MC. Take care and goodbye.